Good morning. So this patient traveled from Spain. She'll be doing two procedures today. One will be a lip lift. The second is a hip dip correction. So hip dips are natural shadows or indentations on the side of the hip in the transition area between the top of the hip and the thighs. This is due to natural anatomy, due to the shape of the pelvis, the muscles, and the fat in the area will delicately fill the area to create a more smooth transition from the hip to the thighs. It's distinct and totally different from a BBL or autologous fat transfer to buttocks. Surgeons are trying to create larger, more full buttocks. This is more of a contour issue, not a volume issue. It'll be performed awake using just local anesthesia and IV sedation. That IV sedation will be very clean, no narcotics, minimal recovery, minimal downtime. She's gonna do amazing. We're gonna reduce a little bit of the fullness in the lower back and add to the hip dip area. She's feeling great, she's doing great. We used ultrasound to make sure that we're injecting in the correct location. The other great thing about doing these procedures awake when the patient can feel it is you always know if you're in the correct, safe plane, because if you're too deep, they feel it and it lets the surgeon know that they're doing it safely and delivering an outstanding result. We've injected all the fat in this area. She's 1 day out. How was your recovery overnight?
It was very good. I had a good sleep and it was so easy.
She's leaving tomorrow on her flight back to Spain. So take a look at her photos from before. And remember, as I taught you before, the hip dip is a transition from the upper part of the hip to the thigh. Afterwards, you can see her here today. She's got enhanced fullness in the area. All of the surgeries were done through tiny, tiny pokes that'll all heal without a scar. And overall, how was the experience? Any pain?
No, it was slightly pain and it was so easy.